Okay. And then, okay, and then I'm going to also share my screen. Welcome everyone to Shakti's empowerment session on preventing intimate partner and dating abuse. We are very fortunate here to have Dr. Manjula Kottapalli, who is a board certified psychiatrist in both adult psychiatry as well as child and adolescent psychiatry. My name is Lalita Aladi, and it gives me great pleasure to have her here today to discuss an important topic. To give you a little background about Dr. Kottapalli, let me get started with, she first of all graduated with her MBBS from Osmania Medical College in India. She completed her residency and her fellowship at Case Western Reserve University in Cleveland, and has been in practice for more than 25 years. Her scope of practice is extensive, from childhood onset disorders to adulthood. She's currently an associate program director at HCA Psychiatry Residency Program at UCF, and she's very well versed in the area of medication management and psychotherapy, and has a holistic approach towards each individual. Her practice is geared towards treatment of ADHD, anxiety, bipolar disorder, schizophrenia, major depression, PTSD, and autism. Dr. Kottapalli is the recipient of many national awards and honors and is a fellow of the American Psychiatry Association. Please help me welcome Dr. Kottapalli today. Dr. Kottapalli, I'm going to let you take over. I'll go ahead and manage the slides and let me know if you need me to move forward faster.
Yeah. Thank you, Lalita. I really appreciate this opportunity. I'm kind of new to Orlando. About 3 years back, I moved from Cleveland, but I'm really interested in discussing such topics at a larger platform, because this really helps our community. Everybody should have awareness. And I think we are all part of the community. We need to prevent intimate partner violence. So for the duration of this talk, I will say that I'm going to call it as IPV, just because it's easier to say. So IPV stands for intimate partner violence, and sometimes it's interchangeably used with domestic violence. But intimate partner violence is very specific. It's between a couple. So a couple that are intimate with each other. So it's quite prevalent. Currently in the US, 1 out of 4 women and 1 out of 7 men have been victimized. About every year, 12 million people report intimate partner violence. Now, I will say the true rate is probably higher because of obvious reasons, because of stigma, because of fear. It is underreported. So IPV in teenagers is called teen dating violence. And in a high school setting, when they did a survey, they saw that 1 out of 5 had admitted to being a victim of IPV. So what I'm trying to say here is it starts very young. It starts even when kids are about 14, 15 years old, and they have their first crush, first boyfriend, from that time till, pretty much into all of adulthood. Socioeconomic status, education, culture does have some correlation with IPV, but in my practice, I will tell you, there are doctors that have been victims of IPV, there are lawyers, there are dentists, there are nurses, there are students, there are, so don't, I don't think we should stereotype that a particular specific group is at a higher risk. In some ways, It's good that we start talking about IPV with our kids if we have kids in high school. And then, of course, as they become younger adults and are actively dating and in relationships, it's important to make them aware of this. So let's move on to the first slide. Okay, so this is kind of the objectives of this talk. So I think after this lecture, we want to know how to spot IPV when you see it. There is a screening questionnaire, very easy, 3 questions that can help you assess if somebody requires help because of IPV, and then how to find help in the community, what are the resources, and what are the steps to follow. And then the last one is how to prevent from being a victim. Next slide, please. So IPV can manifest in many different ways. And even though I have separated them as physical, emotional, behavioral, financial, and sexual signs, a victim can have all of these, or a victim can just have one of these, or a victim can have a combination of this. So just keep that in mind. So the physical signs are, especially for a healthcare provider like me, I'm a psychiatrist. If I see people are coming into the clinic with unexplained bruises, or they're telling me that they frequently visit emergency rooms because they are, injuring themselves, and they do not give a reason, clear reason as to how that happened, I think it's reasonable to be suspicious. Emotional and psychological signs. So sometimes we see young women who come and have very low self-esteem. Throughout the interview, they are on guard. They're very scared to speak up. And you can see that they could even be a little shaky. And sometimes they just are sobbing and crying. So these are some signs that we can see in victims of IPV. Behavioral signs, constantly checking with spouse or seeking permission. So, sometimes I've seen people from Indian community, they come in with a husband and they're constantly asking, can I tell her this? Can I tell her that? Or they're constantly looking at the husband to seek permission, and they're afraid that he may retaliate. Or sometimes the husband is stepping in too much to correct the story, and they kind of are taking over the interview. Financial and digital control. So sometimes patients will say that I cannot text a few people in my family. I can only text this person, or I'm completely not allowed to text anyone. Or sometimes young couple who are recently married, sometimes they'll say, my husband dislikes if I speak with anybody in my family. I cannot speak with my childhood friends. I cannot go out with my friends. So some sort of like, this control over the person is pretty obvious. Sexual and coercive signs is sometimes the victim is manipulated to sleep with the partner. And sometimes her saying no doesn't mean anything for the perpetrator. Now, even though I am saying that the victim is a woman in my examples, always remember the victim can be a male person as well. So it's really important to remember that the IPV does not care. It's not gender specific. It's not, your sexual orientation or anything. It could be between a heterosexual couple, so male, female, or a homosexual couple, which is the same sex. It can be between transgender couple. It could be in any combination. Next slide, please. Okay, so the other thing that is sort of a little complex is it is a reciprocal relationship. So, it's not like just the woman is the victim. It's also, we've seen in IPV that the couple, both are hitting each other, pushing each other. The husband is yelling, screaming, and calling names, and the woman takes a handle of a utensil and hits him on the head. So it could be both ways. So I do want to say that 60% of the time, so that's a pretty high rate that both of them are equally in this violent relationship. And same thing, physical, emotional, and sexual violence can be bidirectional. Current or ex-partners, all genders and sexual orientations. So sometimes the partners have separated because of the obvious reason, but they continue to harass them. They continue to stalk them. They continue to go to the school where the mother is picking up the kids and victimize the children, as well as not the children. They victimize the woman by trying to, just impair her in every area of life. So one thing that's very obvious is it's a power dynamic. The perpetrator or the abusive partner wants this upper hand, wants to the need for power and control. And the other thing that is very pathognomonic of this relationship is violence. So the violence, whether it is sexual violence or physical violence or emotional violence, is really draining, and it affects their mental health. So that's where people like me come in. It's not just identifying, but to educate them that this type of relationship will cause major depression, post-traumatic stress disorder, these type of things. Again, going back to the statistics, 1 out of 4 women and 1 out of 7 men are victims. And this is based on the US stats. Another big one is 74% of all homicides are by sexual partners. Isn't that alarming?
That is really alarming.
Yeah. 74% of all homicides are by sexual partners. So, and predominantly women killed by men. And especially if a woman is pregnant. So in fact, homicides, IPV is one of the leading causes of death in a pregnant woman. So that's the other thing for a physician like me. If I see a woman is 2 months, 3 months pregnant, and she's coming with bruises, she's afraid to speak up, and we notice that something is awfully wrong, whatever we do, we are actually saving 2 lives there. It's the mother and the child she's carrying. So it's a huge responsibility for physicians like myself, and just overall for all the community. Again, we talked about this. The 1/5 of high schoolers face IPV during dating, and that is the term I used is teen dating violence. Next slide, please. Okay, so some of this is, we already talked about. IPV is a leading cause of death when a woman is pregnant. LGBTQ communities have similar prevalence of IPV. 2 in 5 gay men report violence by their partner. And I think the LGBTQ community is just vulnerable in many, many ways. In every, aspect of their life, they're underrepresented. There's a lot of stigma, and people misunderstand them a lot. We see a lot of LGBTQ community in my clinic, and psychoeducation and screening them for any type of violence is also part of their evaluation. 44% men and 36% women of LGBTQ community were reported with IPV to authorities in 2022. So that's a big number. And you can see that this is actually the US stats in 2022. Gender stereotypes can contribute to men underreporting. So when men get beat up by women, there's this shame, this shame. And especially, given the forum, I'm going to touch base more on Indian men. So I've seen that there's a young couple, actually, the husband is the victim and he shies away from asking for help because it's so not cool. It's just not manly. So this guy not only has self-esteem issues, but a big part of this is stigma. It's like, I cannot stand up to my wife and I dare not tell anybody about this. So they suffer in silence. So it's really important to keep that in mind, that as a provider, you should not stereotype your patients. You could see somebody where the victim is actually a male person. Next slide, please. Okay, so factors associated with IPV, even though I've listed this, just take this information with a grain of salt, because this is not all inclusive by any means. So chronic alcohol abuse, so substance use disorders, alcohol, cannabis use, or other recreational substances. So a couple that are into this type of lifestyle, or even the abuser, the chances of IPV are higher. Being young and naive, especially that's where the teenage population is at risk. So when you're 15, 16 years old and you're dating the, I don't know, high school captain or somebody very cool, and you think that's the ultimate thing, that's your trophy, but this person tends to be abusive, they don't know what to do about it. They just think that they have to deal with it. So being young can be a risk factor. Less educated, yes. So people that are not educated, or they don't, they haven't been in school and they haven't been educated about how to protect themselves. But again, I will tell you, your education does not protect you from IPV, because I do see there are a lot of women who are professionals making six-figure salaries that are also victims of abuse. High levels of conflict. So there are a lot of families where conflict is tolerated. Like they just think that, oh, my uncle, he's just this person. He is constantly fighting. They kind of normalize it. They think that it's just part of family. The dysfunction is part of family, and the violence is part of family. And the high levels of conflict can also lead to higher risk of IPV. Lack of communication skills. So there are a lot of young people nowadays that they struggle with relationships, period. Like they are, especially post-COVID, what we've seen is the social skills are kind of dying, in society. People would rather have 100 friends online, but they don't have one real friend in person. Like they won't meet them. So they just struggle with communicating their needs and understanding the other person has needs, and to respect that relationship. So that lack of communication can put them at a higher risk. Insufficient resources. So obviously, think of a young couple, they're just out of school, they don't have enough money, they have to pay the rent, they have to they have all these headaches. On top of that, they suddenly the girl gets pregnant, there's this unplanned pregnancy, and they fight about it and they blame each other, and then there's this a perfect storm for a stage setup for IPV. So these are all things that are a recipe for disaster. Victims of childhood abuse. So there is something, as a child psychiatrist, we call them the childhood ACEs. So those are adverse childhood events. And there are a set of them, and kids who are constantly exposed to violence. So, if a kid is parents are drug addicts and the kid pretty much has to fend himself. He needs to kind of see the bickering of parents every day. For them, at a certain stage, violence is their language. That's how they communicate with their partners. And they've seen their mothers get beat up. They've seen their father coming home drunk and beat up a sister, or so they just think that, oh, fine, that's how you solve your issues. And that's kind of recreated in their adult life. Family dynamic where people are not accountable for their actions. So this is something I see very, very high in our Indian communities, like, oh, we don't speak up to our father. Oh, we don't put our, and again, I'm sorry, I'm trying to stereotype male here. It could be a mother who's extremely controlling and abusive. So it's sort of like, oh, no, he has his moments. When he blows up, we all go and hide. And when he's calm, we come back. But there is no accountability for this person. Like, nobody ever tells him what you're doing is wrong. You need to stop. You need to go get help. And it takes a beating on the entire family, and not just one generation. It can continue in future generations. Next slide, please. Okay. So this is a very simple screening tool. It's called Partner Violence Screening Tool. And just a set of 3 questions. Answers are in yes or no. Very easy to administer. Anybody can do it at healthcare centers, urgent care centers, emergency rooms, in my office, psychiatrist clinics. This is a simple way to get a lot of information. I mean, that red flags go up, and it has 71% sensitivity and about 85% specificity. So that's pretty good. So the first question is, have you been hit, punched, or kicked in the last year? So that's, last year meaning the last 12 months. Do you feel safe in your current relationship? Third question is there a partner from previous relationship who makes you feel unsafe now? So these are all extremely effective questions, very well researched, very easy to administer, and a nice, easy, user-friendly bedside tool, All right, next slide, please. Okay, so when we are evaluating, I'm sorry, was there a question? Okay, so the cultural background of the family is very important to us. We see a lot of cultures, right now we have a big Hispanic population. They are coming from different Spanish-speaking countries, Venezuela, different South America, countries in South America, that there is a very high degree of violence. It's almost like if things don't go their way, there's a very good chance that there are death threats. There is a significant community violence. So it is really important for us to keep in mind what is the culture of this particular couple. Men underreporting and not getting adequate support, we've already touched on that. Again, I can definitely speak for our Indian population, where the victims were actually men, and they just came for a psychiatric evaluation saying, I have depression, I have anxiety, and I have trauma. And when we started talking to him, it appeared as a regular person, a techie who is here has a good job, had a marriage. He married somebody from his school, and things were really good for a year. And later on, all hell broke loose, and he was victimized. And So IPV, again, getting help for a male patient can be somewhat challenging, especially when they are shying away from, not revealing the truth. The treatment is, it's not a one-shot treatment. This is a very complex thing, and you have to take account of both the individuals, and it is something that once we diagnose, the treatment is ongoing, and it has to be ongoing, and they require follow-up for it to be effective. Safe sex education, I would say this is something that all including teenagers should know about this. For instance, no means no. Even in a committed relationship, even in a husband and wife that are married for 12 years, a woman saying no means no. So I do think that a lot of women, unfortunately, don't know that. And they think the fact that they're married means that they just have to agree to the partner all the time. So safe sex education, understanding that sex is one of the last things that it's sort of like when you form a relationship, it should be based on mutual respect and understanding. And especially when it comes to intimacy, like sexual intimacy, there has to be consent from both sides. And it should be out of free will, and it should not be coerced. So it shouldn't be like, oh, we have to have sex for you to go visit your parents. So that's like coercion. Or, yes, you can have the children with you on this holiday, or you can do things with the kids, but you have to sleep with me first. So this is all kind of nonsense. And these are some things that we have to address it in our community. It's also really important that children who are exposed to violence should be treated adequately. And this is not a one-stop check. You do need to talk to these kids over a period of time. When I was in Cleveland, there was a program at Case Western Reserve University called the Children Who Witnessed Violence program. So unfortunately, in inner city Cleveland, where there's African American population, they are very poor. They don't have proper education, proper jobs. A lot of times it's a single mother with who's had children from multiple partners. And unfortunately, these kids saw a lot of IPV, lot of domestic violence. And they thought that was okay. Like they thought that that's just how life is. But eventually, when these kids grew up and became teenagers, became 17, 18 years old, and they themselves were in a relationship, so they sort of like continued to do what they had learned in childhood. So there's a lot of research in this. And I do think that one of the preventative things is to talk to kids about how to respect their own bodies and how to respect another's. Where do you draw that line? Next slide, please. Yeah. So the common theme for IPV is the sense of control. The abuser tends to control the relationship with inducing fear. Mm-hmm. So that's kind of the most important thing we're looking for when we are talking to our patients to see if there is this dynamic going on. Abusers' need for sense of entitlement and need of power are and need for power and control over the victim. So it's kind of the same thing, what I was saying before. The victim may not want the abuser incarcerated, but wants them to get help. So this happens a lot. I've seen a lot of women who they will say, hey, he's the father of my son. He's the breadwinner for the family. I don't want him to go to jail because who's going to provide? I'm already poor. I can't pay bills myself. But I just want this guy to get help for his alcoholism, and I want him to get help for this violence. So sometimes, there is social work involvement, there is a DCF, Department of Child Welfare involvement, and definitely the legal route. Sometimes these men are court ordered to get substance abuse treatment, and they are court ordered to go for anger management, and they have to conduct themselves as improved individuals, and they themselves need psychotherapy, or medications. Lack of good role models in life. So a lot of times these abusers who are abusing, they themselves had poor role models. So, sometimes that's exactly what I'm going after. I'm telling them that because you had terrible parenting, you don't have to be a terrible parent yourself. You can break that cycle. And sometimes the parents, the father starts crying and he says, I can't believe I've been so horrible. And I just realized when you were saying to me that a lot of it stems from my own trauma. So, again, this would be a good situation where you can actually rehabilitate the father, but sometimes it's beyond that. We'll get there. And again, some people exposed to chronic violence are desensitized to violence. So the thing is, just look around the world we live. There is, my heart breaks for kids growing up in Gaza, um, um, and, the bombs exploding every day. You don't know if you're going to have the roof over your head tomorrow or not. There is poverty. There is medical necessities are not being met. Women are being raped overnight because there is who is policing? There's nothing. There's no law and order. So what happens is these kids and these adults are that are exposed to that level of violence think that hitting somebody or giving somebody a black eye is no big deal. It's nothing. You break somebody's teeth at school, or you get into a fight and you give another kid a concussion, it's no big deal. But it's really important for them to know that no, that is battery, that's assault. You can have charges. These charges can haunt you for life. These charges can prevent you from getting certain coveted positions in life. So I do think that it is very important that this should be conveyed to even in school settings. Next slide, please. Okay, so prevention for abuser. So the guy who is abusing, who is controlling. So what can we do about that? So the number one thing is psychological evaluation. Why does this guy always hit people? Is there something going on? And I do want to tell you that IPV in itself can cause mental health issues. But the mentally ill, people who already have schizophrenia, bipolar disorder, are also high risk for IPV. So it's kind of like that double-edged sword. So number one thing is decrease violence at home. So, we do a set of questionnaire when we are, somebody will say, I'm court ordered to see you. I'm like, okay, what happened? Well, I was at home and this guy, my friend, came and we were drinking and my wife said something and I got upset and I hit her. I just tapped her, but her tooth fell out. Well, that's not tapping. So the point is, We then check what other incidents have happened. Has he ever been involved in had a legal problem before? Any arrests, any um, charges filed, any time done served in jail, and you'll be surprised. A lot of times that stuff comes out for the very first time. So we do realize that some people have antisocial personality disorder, or they may have something more than that. They could themselves have bipolar disorder or substance abuse disorder, and that requires actual psychiatric treatment. And usually, sometimes it's good news if they're willing to get treated, and sometimes they're only in treatment because it is court ordered. Um, and sometimes they will say, well, it was exaggerated, it wasn't my fault. Well, my wife was also hitting me. You're not listening to her, you're only listening to her. So, all this drama does happen, but we need to kind of do a very careful evaluation and see what's going on. And like I said, if they do have an underlying mental health issue, we usually treat it, and sometimes it requires medications. And we have some very good medications at our disposal that can help them. Sometimes they require psychotherapy because a lot of it is childhood based. They themselves have been victimized as young adults, and they've never had a space to talk about it. So a combination therapy like psychotherapy and medication management can also happen. Providing resources early on in psychoeducation. So, sometimes I see very young kids in my clinic. They are students at UCF. They're only like 18, 19 years old, and they will tell that, I'm in a relationship. I feel very forced. I suddenly feel I have no say in it. Suddenly I feel like I'm doing things that I don't want to do. And that is enough for us to say that, okay, you should not do those things, and these are your rights, and this is how a healthy relation should be. And sometimes that's a wake-up call, and they do benefit from that. Pro-RS have helped in decreasing the number of IPV over time. And so what happens is sometimes in an IPV situation, the wife gets hit and she will call the cops. When the cops actually show up the door, she's scared to say anything about the partner. And she'll say, well, it was a mistake. I don't know why I called you. I don't want to push charges, and you can leave. But pro-RS means the second they realize that something is wrong, say, for instance, the wife has a broken lip or there's a black eye, and there's this husband who's staring her down from the corner, or whatever's the case, the police can arrest the person. Doesn't matter if the wife says, please don't arrest him. They can do that, and the pro-RS have actually helped in decreasing the number of IPV over a period of time. Increased number of batterers in court. So any contact with another person without their permission is called battery. So number of batterers in courts, so that indicates that this is taken seriously. Only thing is, it does have to come into limelight. Development of batterer intervention programs. So the BIP programs, a lot of them are court ordered, but there are a lot of communities that have the BIP programs. And, a lot of it is psychological evaluation, support groups, making them understand that the person they desire to live with has her own rights. And if the relationship is unhealthy, they need to kind of address that. So the Duluth model, so this is just what I looked up, and it basically says men control women in patriarchal model. So the Indian society in some ways is somewhat patriarchal, although it's changing very rapidly. But It's not true. I don't think that men should always have the upper hand. This is it should be of mutual respect, and both men and women both have shared responsibility to make the relationship work. Next slide, please. Okay. So for the victim, so the number one thing for the victim is if you see obviously somebody's bleeding, somebody needs a stitch, somebody has a black eye, they should immediately be getting medical help. Sometimes we have to call DCF right away from our clinic. Sometimes we have to hospitalize the woman because, say, if so there was this Bangladeshi couple and this lady was, obviously victimized, and she did finally admit to that. So for her own safety, we had to hospitalize to get her all the help, get her mental health help, and separate her from the abuser. And oh, can we go back up?
I'm sorry, went up.
Go back to this. Yes. Okay. So so timely reporting can be life-saving. There are some women who've been beaten up so much that they are suicidal, like they don't want to live anymore. And it's really sad to see that. But again, we also, as psychiatrists, prevent suicides from occurring, and we have to timely hospitalize them for safety. Leaving the situation is helpful. Sometimes, women are like, no, this is happening, but I don't have any other place to go, and I can't go anywhere. But we don't know if one more night with the same person will lead to her death. So we usually say, no, right now you need to go to the battered women's shelter. Within 24 hours, we'll activate all services for you. And sometimes leaving the situation is the most important thing. Remove the victim from the abusive environment, remove any weapons. So this is a thing. We live in America, we live in Florida, where gun control is like kind of not there. So, and guns are lethal weapons. There is no taking back. And there are several times where I had to step in and remove the guns from home, call the sheriff's department and say, this is the situation. This family should not have any access to guns. And the guns are removed from the home. Social work, DCF, law enforcement involvement, and medical and psychological help. All right, next slide, please. Okay, so again, we did talk about the reciprocal IPV, even though I kept saying the woman gets hurt, sometimes it's a combination. They both are hitting each other. They both are leaving bruises on each other. They both are yelling and screaming, and the kids are watching. So what we realized is that this particular couple has some cognitive deficits, which means they don't have the problem solving skills. And so that is something that we do have to address. Skills training and communication. How do you communicate respectfully? How do you, if you feel your needs are not being met, instead of being violent, how can you communicate with words? Culturally focused IPV. So I've seen a lot of one case where an African American man, he just said that my wife cursed at me and I washed her mouth with soap. And I'm like, wow, how do you think that's okay? And he said, well, that's what happened to me when I was a child. That's what my father would do to me if a bad word, 4-letter word came out of my mouth. So I did that to my wife. So we were like, all right, this is abuse. You can't do this. So a lot of times, breaking that cycle, making them understand, educating them, and saying, no, this is corporal punishment. You cannot lock her up and not give her food and not give her comforter when it is 30 degrees outside. You can't do that. That's all abuse. So a lot of times it's like a wake-up call for these men. They're like, oh, really? Well, my mom used to have all this going on, so I thought that was okay. So it's not okay. Motivational interviewing. So it's sort of like, it's a technique. Motivational interviewing is a technique. Is like, okay, obviously you both were high school sweethearts. You wanted to live life together. What is the hurdle? Is it still going to work? How are you, what is motivating you to be together? What is your common goal? Well, I want to help him through school. He needs to help me with my med school. Okay, great. You both have great ideas. How are you both going to do it respectfully and kind of grow up together? So motivational interviewing can be very effective. Fluoxetine. So this is a SSRI. It's a very typical antidepressant that we have used for IPV. There's a high rate of major depression, anxiety, PTSD that goes along with this condition. And fluoxetine is just one medication. There are 30 other meds that we can use. Sometimes the couples don't yield. They just like keep on fighting, and we are afraid that one of them will end up dying. So, court-ordered treatment. And what happens is the police says, oh, this family, they've called us 6 times just in this last week. So now these charges are going to a higher level. So court-ordered treatment. Substance abuse treatment, a lot of times there are couples who are usually okay, like majority of time okay, but when they get drunk, they hit each other with beer bottles. They do all kinds of things that is considered IPV. So it's a very comprehensive approach, and the evaluation is extremely crucial, and it has different steps. And I think there's a lot of help available for the couple. Next slide, please. Okay, so we are at the end of the talk. 988 is a mental health crisis line. It's 24/7 available. So like I was saying, sometimes the abuser may be homicidal towards the lady, and the victim may be suicidal because she can't take it anymore. So not just that, like depression, anxiety, trauma, just a number of things can happen to a couple that is in IPV. So mental health crisis line is very, very helpful. There are other hotlines, crisis services. In Central Florida, there is Harbor House of Central Florida that has emergency shelters, counseling, legal advocacy, and other. They're just like resources I cited. So that's the end of the talk. And like I said, I do feel that it's everybody's responsibility to keep our communities safe. If you know of somebody who's experiencing IPV, there is a lot of help available. And I do think that each one of us has the responsibility to keep people safe. The last thing you want to know is somebody just died because they couldn't take this IPV anymore. So with that, I will stop.
Yeah, no, thank you so much. I can't say how helpful your talk has been, because it's, first of all, reiterates a lot of what we talk about. Of course, we talk about it in different in parts, but you've really brought it all together in a very meaningful way for us. And with your with your experience, you've been able to speak about how you've seen it come into play on a daily basis. So that's also good for us to understand and hear, to really see how we are talking about it in a general way, but you've really given us some specifics. Now, I want to touch on a few things that you brought up. First of all, thank you for sharing the resources at the end. We also, if someone can help me out, Madhu, Jamie, Anu, if somebody can just drop the Shakthi hotline number there as well, because Shakthi has not a hotline, sorry, helpline, yes, we assist South Asians who are survivors of domestic abuse, but we will still, you don't have to be South Asian, but when you contact us, we'll try to put you, in contact with the right resources that you require. So that's one thing I just wanted to point out, in addition to everything that Dr. Kottapalli has mentioned. Also, we have a few programs, because you had mentioned during one of your slides, that they don't know what to do. They want help, right? They don't necessarily want to have their partner arrested, but they want to figure out a way to get help, to put a stop to it, and sometimes just removing them from that scenario at the moment, that itself can be helpful. Well, with respect to that, we have different programs, but one of which is our most recent one, which is for housing. So if someone requires some help, where maybe they just need a week to figure out a plan for them, for their family or something like that, we have a housing program where we can provide you with resources, financial resources, to help you get out of that situation for a short time. Or maybe it's a whole month's rent, or maybe they've come out of that situation, but they need something to tide them over during that period. So when they need a different kind of help to break from it and find a strategy, we can provide certain resources. So we just want to extend those resources to anybody who might need them. But now I want to ask you some questions. And please, if you have questions, please put it in the box, or you can even privately send it to me. If you don't want to publicly put it in there, I won't mention who asked the question. But you had mentioned about the Duluth model, and I wanted to ask you a little bit more about that, because this is the first time that I've heard about it. Can you explain a little bit more in detail what that means? You said that in a more patriarchal society, the Duluth model explains that men are typically more in control. Is the Duluth model explaining how the situation arises, or how to get out of it? Or can you talk about that?
Yeah, I will say that I'll have to look it up one more time before I give you the whole thing. But so the Duluth model, basically, they were looking at how the culture has, is there a correlation between the culture and IPV? Okay. So the Duluth model basically says that in patriarchal societies, it's the men who have this upper hand, and but really the limitation is, if you did that type of if you're screening based on that, you're going to miss a lot of men who are victims. So I think that was a point of it is, and I think I made a point in a previous slide that a lot of times, we just think, just being an Indian woman, that victims are always women, somehow we just think that, and that's not true. And I do think that keeping an open mind is so important. And this is something I teach the residents. I'm the associate program director for a residency program. And as psychiatrists, sometimes we are seeing something first time, and it is really important to know what kind of culture does this person come from, because that can have a lot to do with, it can explain a lot of things. Sometimes we see women who are extremely conservative background, but they stand their ground very well.
Yeah.
They will I mean, I've seen women
Advocate.
who are completely covered head to toe, but they will come and say, well, the second he put his hands on me, I was out. I'm
Right.
like, well, good for you, so
Right.
it's sort of like
Yeah.
you just cannot say two plus two is
Absolutely.
always
Yeah.
four.
Yes.
You can't have a cookie cutter model.
Absolutely. Yeah, you're right. No two situations are the same.
Exactly.
And that is one of the reasons that even Shakti was founded, was because we recognize that yes, there are some cultural situations that may not always be understood. As an example, arranged marriage, right? That might
Mhm.
not be something that's always understood at all safe houses where you could seek help. It's not to say they cannot help, but maybe certain situations, just there are biases towards it. There's not a full understanding of it, and we wouldn't want that to prevent, because of a cultural stigma, prevent them from really getting the help that they require. So
Exactly.
that's one of the reasons that Shakti was founded. We also have a question here.
Mhm.
The question is, what is the best way to educate on communication skills in the South Asian community, and for both parties to learn about interpersonal communication skills, which they may not have been brought up with? So they may learn to communicate with boundaries, etc. What do
Right,
you
right.
suggest?
Oh, yeah. That can be a talk in itself.
Yeah.
But I will tell you, since COVID,
Yeah.
okay,
Mm-hmm.
since COVID 20, actually, there was a study done in 2020 that
Mm-hmm.
shows higher rate of IPV during the social isolation, because
Yes.
the abuser is always with the victim. So
Right.
the rate of
Oh,
IPV
yes.
just was skyrocketing. But anyway,
Yeah.
going back to this communication, I will tell you, uh, I feel that with the technology, and especially post COVID, this work from home concept,
Yes.
people, communication skills have dwindled like
Mm-hmm.
horribly.
Right.
And I'm also a child psychiatrist, so I see a lot of kids. They spend hours on gadgets, like
Yeah.
iPhones, your iPads, and but they don't go out and talk with a group of friends. They don't know
Right.
how to disagree without a major fight,
Yeah.
and
Yeah.
to respectfully disagree, to have a
Right.
difference of opinion, but still
Right.
be respectful. And so I do think that even I see students who are from UCF, they're doing undergrad, or that they just struggle to communicate effectively.
Yeah.
And I do think that I mean, yes, I keep blaming COVID for everything, but there are families where communication is not used effectively. It's just there, like uh, parents and siblings, and the relationship they have is very much based on whose needs and wants have to be met. That's it.
Yes. Yeah.
So what happens is, in a young couple, if they're coming from two different types of families, say if a woman is, I'm just using this as an example, and if it's a bad example, forgive me, but say if a woman is raised in a city, okay, she's used to advocating for herself, she's drives herself to her school, and she has friends, and she has social circle, and she is used to
Yeah.
expressing her opinion, and she's advocating for herself.
Yes.
And let's just say the partner she finally is with is raised in a very conservative family where women don't speak up,
Yeah.
where women just have to listen to what the men say,
Right.
or the men just decide, the men control the money, the men control the decisions. uh, Believe me, they will have a clash when they're going to be sharing a roof.
Of course, yeah.
And it's no brainer, it's no brainer. But the point is this, I'm not saying that will not work. I think a lot of it depends on the willingness to work and the willingness to say, if you say, okay, I used to think like this because that's what I saw between my parents, but I see that my partner dislikes this. So I want this to work. I want our relation to be successful. You need to communicate and understand each other, that you have to give some and take some for a relationship to work, so as long as that is there, that the desire to understand each other, to communicate with each other, and I wouldn't even shy away from getting some couples counseling.
Yeah.
Yeah.
So couples counseling is one great way. I would say we have more questions, and so I'm going to address them. I know that we finished our hour, but this is such a great conversation. So before I continue with the questions, in case anybody needs to drop off, I just want to talk about two things that for Shakti next week. Like I mentioned earlier, we have a lovely Women's History Month March and Picnic next Sunday at Fort Mellon at 11 a.m. The registration is on the front of our website, and the website is in the chat. So please click there and register to join us. Completely free event. And at the event, we will be having a henna artist. We'll be doing some Bollywood dancing, paint your own canvas, all kinds of fun things. And of course, with the food. The purpose of the event is for you to bring your family with you and to raise awareness around domestic violence and to just have a conversation about it. So we do encourage you to bring your family and friends to it, but please do register so that we are well prepared for our lovely group. That's number one. Number two, we also are hiring at Shakti. We are looking for a program, and let me make sure I get this right. We are looking for a program manager, a part-time program manager. So if that sounds like something that you or someone you know would be interested in, again, please go to our website. At the very bottom, you'll see all the job description, and you can apply for it there. So I do encourage you to share that with your friends. With that, I want to come back and talk about some of these questions that we have here, because the questions are very good. I'm going to start with Ruchi, who's raised her hand and waited patiently. Ruchi, you have a question for us?
Yeah, I just want to talk about therapy and IPV situation, domestic violence situation. I will never recommend couple therapy in IPV situation. They need to go for individual therapy first. And after if situation is safe, then the couple therapy can take place. Never ever, I will refuse to work with a client who I will say I will work with you individually. I will not work with you as a couple, because this is a power and control situation, and the person who has power and control is going to manipulate the situation. So, and it is a very unsafe situation for them. So,
excellent point.
Yeah, that's a very good point. Because I think you're right. And I've seen a few couples in that situation. I am not a psychologist or therapist, but I've seen personally that type of a situation. And you're absolutely right. They come back and report that that when during the discussion, the conversation went a whole different way than they really needed it to go. So
Right.
that's very good, very good.
Right. Yes, I agree with that. And I was kind of more focused on a case that we saw that kind of amicably resolved. So, but I understand in IPV, individual counseling is the thumb rule. Yes.
Yes. Another question that we have, an individual says that they had an arranged marriage from India, and her ex-husband was an Indian American. They mentioned that he had a case, but both he and his parents refused to talk about it, exercising his right to privacy. She was not allowed to ask about the details. And so she wants to know, is there a way to deal with a situation like this where there's no transparency for the couple to have a better relationship or understanding, like how would you deal with a situation like that? Do you have any suggestions?
You know, I think if you are going to spend your life with somebody, you should know everything about them as much as possible, because, you know, but the point is this, I would question, why are they so tight-lipped about it? Because see, the danger for the girl is this could happen with her also. Let's just say, I'm going to quote a very extreme example. If the ex, I mean, whoever is charged with attempted murder, would you like to marry that person? You know, so the point is, I think even when people don't have any kind of criminal past or any major, just being married is quite, it's, you know, you have to work at it. You understanding another human being is takes a long time. So I would say that I would definitely take that as a red flag.
Yes.
Of course, I need a lot more information to advise them, but I would say that it doesn't bode well.
Right. Yeah, no, I think that's really good advice. If they're not able to share, you know, and they're going to share their whole life with you, if they can't share that part of their life, then there's something going on that will eventually spill over and affect you as well, right?
Right.
Yeah. Okay, well, those are the questions that we had. And I'm sure that we could, you know, definitely talk some more. This was a very illuminating conversation. And I really appreciate you, Dr. Kottapalli, for sharing your knowledge, your experience with us. I think you hit some really great points, give us a lot to think about. And, you know, we hope to have you back at Shakthi soon.
Oh, sure.
Yeah.
Yeah.
So with that, I want to thank you and thank you everyone for spending some time with us on a Sunday. We not only had more folks than originally registered join us, but also hang out with us for a little bit longer because this was such an important and riveting conversation. So thank you so much for your time.
Thank you for this opportunity. I really enjoyed, you know, being here. And, you know, I think that for me, doing this for 25 years, you know, I feel like mental health is really at the forefront right now.
Yes.
And
Yes.
especially after COVID, it's just really bad. And we all have a part to play, you know, in making the community safer, to make everybody's life better.
Yes.
So whether you're a teacher, you're a housewife, you are a good neighbor, you know, whatever it is, you know, I think that we all have a part to play in this. So I'm just doing my tiny bit today, but I really appreciate all the comments. And Ruchi, thank you for your suggestion. And you know, I really appreciate this opportunity. Thank you.
Thank you. Have a great day.
Too.
Thank you.